And my slide says expect maybe some reduction in premiums long term. Yeah, well, that's very hopeful. That's very hopeful. Expect increases in the near term, absolutely. Absolutely. There'll be huge pressure on providers now with 6 million new covered lives in Texas. The shortages of healthcare workers, positions that is largely in the news, nurses, pharmacists, technicians, therapists, all of that, now that have been largely shielded by this this group not having ready access, now is ill-prepared to take care of this onslaught of folks. So these shortages are going to be exacerbated. That's going to put upward pressure on prices, wages, in the industry, and it's going to be further, I think, further inflationary forces will present themselves. Another interesting deal, and this is sort of where the camel's got its nose under the tent a little bit on this whole, people characterize it as being socialistic. And I think that's going to be dangerously accurate moving forward, because many physicians today won't accept a Medicaid patient because of the rates of reimbursement and that kind of thing. There was a huge lawsuit in Texas 2 years ago called the Frew case that raised Medicaid reimbursement for providers because of an access issue. So they did that. It hadn't had any impact on access whatsoever. If you add 16 million more Medicaid lives in the nation, 1 million in Texas, and the doctors don't accept them, I think the likely response of the federal government now is not going to be, we're going to pay you some more money. They're going to say something like, if you don't do, in order to participate in the Medicare program, which is the senior program, if you want to do that, then you're going to have to also participate in Medicaid, and doctors can ill afford to walk away from the Medicare program, so therefore they'll co-opt their participation in that regard, and the federal government has just taken yet another step in terms of making significant decisions and co-opting support for their plan. On balance, economically, it should be positive. Ray Perryman's number, again, $3.25 for every dollar. Healthcare is a powerful engine for very labor-intensive, lots of jobs, generally high-paying jobs, and that kind of thing. And that's going to continue. We'll see some sort of lever, whether it's $3.25 or, it may be $3.10 of that $3.25 may be an IRS agents and all, but it will have a positive impact on the economy at a macro level. Finally, the doomsday versus nirvana rhetoric is going to continue. Clearly, both sides are wrong. This legislation is neither as bad as the opponents would suggest, nor is it as good as the proponents would have you believe. We don't know all the impact yet. There are 150,000 moving parts. No one can say for sure. One thing that will happen, this will cause significant pressure on other state expenditures like education, like transportation, not just in Texas but in other states. And we'll either deal with whatever these increases are going to be at the state level in healthcare. We'll either deal with that as an offset by reducing our spend in these other areas. Otherwise, tax increases are going to be likely. There's going to have to be some issue because states have to balance their budget, unlike Washington. We have to balance our budget. And we're going to see all kinds of sort of brother and sister turned against brother and sister. Local, state, and federal entities will be shifting costs and obligations, and this is your obligation, and we're going to push this down to the state, and the state's going to push it down to the county, and the county's going to push it down to whoever. And then they're all going to blame the feds. And so there's going to be all sorts of jockeying, I think, over the next couple or 3 years with this sort of risk shifting between governmental entities, I think is quite likely.